what's been happening since the last time we chatted. Eddie, thank you so much for joining us today.
Good to be back.
So our most recent reported case numbers in Utah is 3,445 total positive cases with 34 deaths. Have we hit Utah's peak? And if not, do you think we're going to start to see that peak in the later weeks and months to potentially come?
Gosh, if I had that answer for you, Amanda, that would be just amazing, wouldn't it? No idea if we've hit our peak. We had our peak caseload probably about 2 weeks ago. And what we can, without a doubt, definitively say right now is that our curve is flat. Okay, so our curve went up pretty steeply and now it's just leveled off and it's flat. And that's exactly what we wanted to happen. And most likely social distancing, closing schools, closing restaurants, that's what's resulted in this flat curve. And that's just perfect because it decreases the burden on our hospitals, and our hospitals can stay open and manage the patients that come in with COVID-19. When we hit our peak, or if we've already hit our peak, is the $1 million question. And the modeling within Intermountain Healthcare, and so there's lots of models out there trying to predict when people hit their peaks. There's a model out in Seattle and Penn and Hopkins, all of these models. We've taken those models and we've created an Intermountain model based on our data here, and it predicts the peak out into July. And so there is a potential that we stay at these low levels and then we peak in July and then the numbers decrease after that. That's probably what the best model shows right now, but we have to realize that this is a novel coronavirus. And models can be great and they're helpful for us from Intermountain to predict and ensure that we have enough bed capacity, enough people to staff those facilities, and enough supplies to manage that. But it's a predictive model. And so it's really kind of, it's the best guess that the peak will come later and it'll be lower, and that we can manage these patients. So hard to say. We're just going to have to, keep modeling this out with more and more data.
And how has the public's heightened awareness of viral infections kind of shaped how we work, play, and interact with each other in the future and the new normal? Can you talk a little bit about that from your perspective, specifically with infectious disease as well?
Yeah, I mean, life as we know it right now is dramatically different than it was back in November and December and even early January. People are staying home, they're telecommuting, we're doing telehealth to do the majority of our outpatient clinic visits. We're far away from the new normal, and people have been incredibly educated about the transmission of viral infections. What we're going to see is that our numbers over the number of months, we'll get through this peak and the surge and they'll come down, is that it's going to have changed the way we live and how the way that we interact. There will be a component of social distancing moving forward for at least the next year, potentially even longer. Coronavirus is kind of here to stay, we anticipate, for a while until a good vaccine, a good therapeutic comes around. And so we will be obviously loosening up the way we're doing social distancing. We'll be getting out, we're going to be interacting with friends and family. But the way we think about it and the way we act, it's going to be different. We're going to be a little more cognizant of who we're engaged with in close quarters. What they do is going to really impact whether or not we're going to want to interact with them in terms of bringing them into families that have young kids or compromised immune systems. We're really going to have to, take a look at these large congregate gatherings. Are we really going to be going to indoor concerts, Utah Jazz games? What is the future of that in the near future and kind of year to 2 years? I think is kind of anybody's guess at this point, but it's really going to be called into question.
So that also brings up the fact that there's a couple different counties in Utah that are speaking about reopening businesses soon. Once that does start to take effect, what do people need to remember when they start to go to businesses that they haven't been to in a while? And when can we kind of expect businesses to reopen even more?
Yeah, we really want the data, the epidemiology data, to really drive the economy open. And so we're certainly working in lockstep with the governor's office and his Utah Leads 2.0 plan, I think, is a good reflection of allowing the numbers to drive the way we interact with businesses and each other. And so as we see these numbers being flattened and hopefully decreasing here in the next coming months, I think that's when we're going to start kind of liberalizing and getting out and using some of these restaurants and other companies. But I do think as we still have cases circulating in the community, those businesses and restaurants are going to look a little different. Seating in restaurants may be certainly more spaced out. There may be a bigger focus on takeout. I doubt that bars are going to be opening, anytime soon, because it's a really close quarter congregate setting. And so I think as numbers go down, we're going to have loosening and more loosening of social restrictions and more businesses coming on board. But I think the way we interact with them is going to be inherently different as long as we have COVID-19 circulating, especially for those that are in high risk groups. And so if you're in a higher risk group, whether it be age category or immunocompromised or other comorbid condition, the way you interact with businesses and your social network may be different than somebody who is young and healthy and lives alone. And so there's really going to be variability in how people are going to interact with that.
That you kind of touched a little bit on this, but I know myself, I have these conversations with my family all the time about when we can start going to other people's houses and mingling with them a little bit more, because we all crave human interaction. Right. And it sounds like it's going to be up to what happens with the cases and what the state recommends. But even if we are going to choosing to go hang out with friends right now, should we be wearing a mask? Should we be sitting far away from them? What's your kind of recommendation for that?
Yeah, so I would say that the time isn't yet. We still have about 100 to 150 new cases per day. That line isn't going down, the line is flat. And that just means that every day we're seeing 100 to 150 new cases being diagnosed, which are now going into the hospital, getting intensive care unit management, and probably about 90% still quarantining at home. And so we're not seeing that line go down yet. And so I wouldn't say that we're going to start loosening some of these social distancing practices until we start seeing a significant decline in the cases. So I think that's the first point to be made, is that we're still not there yet. We may be heading that direction in the next few weeks, but we're just not there yet. How to interact with a potentially limited social network. I think people are getting creative on this. I can tell you my family is. We have a house that has a balcony, and we've invited another couple over, and they're sitting below on the balcony. We're sitting on the balcony, and we're happy at safe distance. We've seen people in local parking lots where they've backed up their cars or trucks, and they're 10 feet from each other, and each family's got a little spot, and yet they're still able to have a social conversation, be together, and enjoy that company. And so I think people are getting creative on how to do that, and clearly social media is helping. But until we start seeing those cases go down, we're really not going to be encouraging getting together in close quarters or having people over to the house. We're still going to engage in these socially distant interactions. That's
a good thing to consider, being unique in how you hang out with someone. We also know that schools are not going back into session right now for this school year. What do you think about for the fall? Is there a chance that we might not go back to school in person for the fall, or what are your thoughts on that?
Yeah, we're too far out to even speculate too much on that. I think the intent and the plan for the education division or department within Utah is that, yes, absolutely, we're back in school in August. But again, we're going to have to allow our numbers to direct that. I anticipate by then our case loads are going to be decreased, and we're likely going to have intermittent sporadic cases within the community. We also, can't really predict in 4 months, what is our testing going to look like? We've had such innovation in coronavirus testing that it's hard for me even to think about what it's going to look like in 4 months. We might be to a point in 4 months where we can be doing daily saliva-based testing at home, for example. And if that's the case, we can be providing samples, getting essentially pretty real-time data on whether or not people are infected, and then they can be quarantined and people can go back in the community. So it's really hard to kind of look forward that far ahead. But we anticipate, as long as case numbers are down, and we're having intermittent sporadic cases, and we have the ability to test quite a few people, that school should be back in session. And we anticipate that that's going to happen. But at the same time, we also have to really keep in mind and keep a really close attention to these epidemiology curves. We anticipate across the US that we will see second surges of coronavirus. It's just bound to happen. And we're going to have to be able to react to that as a healthcare network and also as a community to say, oh my gosh, we're seeing this huge spike in cases. Maybe it's in September, kids are back at school, and we're going to have to convert quickly to online school and back into social distancing structure. We're just going to have that flexibility within our community to be able to react to those numbers. And it's going to be driven by what the virus does.
You brought up that second wave too. We were speaking earlier about the fact that the fall is also flu season and how that could kind of come into play with coronavirus being still active and the flu being active. What are some things that we can do to prepare the community for having both of those viruses circulating at the same time?
Right. I mean, when you look at what happened just here with us in March, is that really when we started having this kind of peak number of cases, peak as in what's been going on in the past month or so, it was at the same time that flu cases was going down. And so it's actually pretty beneficial for us, both from a diagnostic standpoint and also from a healthcare utilization standpoint. And the fact that we weren't getting a ton of overlap with influenza. CDC Director Redfield was out talking about this the other day, that we have to anticipate a second surge in the early winter, late fall, that will likely coincide with influenza. That creates a number of challenges. One is just the diagnostic testing. We're going to have to test for both flu and coronavirus, and the management issues. But it's also a lot of people get sick with influenza, and many of those people end up in our ICUs and in our hospitals. And if we're in a position where those hospitals and ICUs are filled with coronavirus patients, we need to do everything we can to minimize the impact of influenza. There's only one thing that does that, and that's influenza vaccines. And so we are going to have to be, as a community, aggressive about flu vaccination to ensure that just about everybody in our community that can get a flu vaccine has a flu vaccine, to really decrease that burden on our healthcare system at a time where coronavirus could also be circulating and causing significant illness.
Yeah, that's a really good thing to consider. I hadn't really thought about the fact that they could coexist at the same time, but you're very right. Fall is a lot of times when people get sick with things. The other thing that we keep getting questions about is the antibody testing and when it's going to be available to the community, what we know about the testing, and really what it means. I know that in conversations that you and I have had, that just because you get the test doesn't necessarily mean one thing or the other. It depends on the situation, right? So do you want to explain that a little bit more about what we've been doing with that?
The antibody test is available in the community. Okay, so ARUP has an antibody test that has been validated and appears to be a good test. It's important that we recognize that ARUP has a good test, because on the market, there are a whole host of antibody tests that have not been validated and don't appear to be a very good test. ARUP has an excellent test. They have the ability to test quite a few people per day, but not nearly to the extent the volume of tests that we do for diagnosing acute infection, the nasal swab. Okay, so yes, the test is here. It's available at ARUP in limited quantities, but we do have access to it. So that's the first question. The second test means is that you've been infected with coronavirus and that your body has mounted an antibody response to it. That's it. The other potential that it could mean is that it's a false positive test. And so in a population with really low prevalence of coronavirus, meaning just there's very few people that have had coronavirus, the likelihood that that positive test is actually a false positive is actually really pretty high. And so you have two options when you have a positive test. One is that, yes, I've been infected with coronavirus in the past, or two is that it's a false positive. If a patient has had signs and symptoms that were consistent with coronavirus, and time has gone by, and now you do the antibody test and it's positive, well, that's more likely to be real. Okay, but if we start doing these tests on a lot of asymptomatic people that haven't had exposure or infection to coronavirus, the chance of giving false positives goes way up. Okay. So we have one point is that we don't know what a positive test means in relation to immunity. And so if you have a positive test, I can't tell you that you're safe and you won't get coronavirus again. We just don't know that. We don't know if that antibody response is protective from another exposure to influenza. And if it is protective, we have no idea for how long that protection will last. And so if you look at regular circulating coronaviruses that we have in our community that cause common colds, for example, we get those repeatedly as children and as adults. And immunity to those common strains of circulating coronavirus may last anywhere from 2 months to a year. Okay, and then that immunity wanes. Okay, but then if you look at something like MERS-CoV, that you have long-standing immunity for, and that's a different type of coronavirus. And so we just don't know. The scientific community hasn't caught up to that because we haven't had enough time to study it. We don't know what a positive antibody means, aside from the fact that, yes, you've been infected with the coronavirus in the past and you've mounted an antibody response. We don't know if that means that you are protected for 2 months, a year, 2 years, indefinitely, or not at all. And so that's a really key area of science right now that many people are going to be looking at, especially those that have been infected, have a documented antibody response, and then followed in the future. So at this point, test is here. We have to interpret it with a lot of caution. We have to use it in the right patient population. And we have to be really, really aggressive with not changing our social distancing patterns and not changing how as healthcare workers interact with patients when people have positive results. And so right now, it's a really hard test to interpret. And we're not going widespread with this. One of the things that it will help us with will help the Utah Department of Health, Intermountain researchers, Intermountain Infectious Disease, University of Utah researchers to really assess how prevalent this infection has been in the community. And we can do large scale evaluations with antibody testing just to get a better sense of how penetrant this virus has been in our community. Those studies are ongoing and in process right now.
That's really great information. And I just want anyone to know too, who's watching this, once Intermountain has more information on how you can get the test and when that's going to become more available, we will definitely let you guys know. It's not something that you can just call your provider right now and ask for. So we will update you guys as soon as we have more information for the public for that. Eddie, thank you so much for joining us. I think a lot of the information you said was great today, and I hope people really listen to the fact that social distancing still needs to happen, regardless if businesses are opening or not. It's still something that we need to be thinking about all the time. And if you do have any mild or moderate symptoms of COVID-19 and do want to get screened and tested for it, you can get tested with just one symptom now. And you can call our COVID-19 hotline at 844-442-5224. They'll screen you and then let you know of a testing location near you. Eddie, again, thank you so much, and we'll talk to you next time.
Thanks so much.